بسم الله الرحمن الرحيم. السلام عليكم، يعطيكم العافية. اليوم بدنا إن شاء الله نطلع على موضوع صورة الأشعة وكيف نطلع منها الكاركترستكس أو الباراميترز تاعت السكوليوسيس اللي ريليتد ل البروبر diagnose والبروبر treatment protocol orthotic treatment protocol بالنسبة لمريض السكوليوسيس. فحناخد احنا سامبل، حنطلع كيف نشوف هاي الايمج، how to view it, how to look at it, what areas to focus at, how to draw our lines, how to measure the angles, and then how to define the curve and identify the treatment protocol. So as a start, as you all know, the investigation for scoliotic patient, or when you have a scoliotic patient in your clinic, even before you know that he is definitely having scoliosis, you'll have to go through the screening and then looking for signs, history taking, and finally when you are suspicious that this patient is might actually be having scoliotic curve, then you go for the X-ray imaging. As a start, you might start with an AP or PA image just to identify if there is a side-to-side bending or not, as well as a rotation, and then you'll go for the proper first identification and investigation for a scoliotic patient, which should include 4 images: AP, PA, AP or PA, depending on the protocol that is used in the clinics. As we have said before, the most appropriate way to image the spine is PA due to the radiosensitive organs that are present in the area of exposure. Then we'll have to have a sagittally plane image, a lateral bending image, one to the right and another to the left. Of course, it depends if the patient is having an S-shaped curve or not, because the lateral bending images, as you all know, are taken to identify if the curve is structural or non-structural. So now, after that, now we have the AP, or this one is an PA image. This image should be taken in an erect position or standing whilst the patient is standing, because this is the actual representation of the curve. Now, whilst the patient is lying supine, let's say that the patient has undergone a CT scan or MRI image. Now, CT scan for bone visualization, so the patient is supine, and this will lessen the degrees of scoliosis. So when we want to identify the actual degree, we go for the X-ray standing image, erect standing image. Now this is the image that we have. The image should be a full spine image, and that's why, as you see, it includes the spine from the cervical region, almost the cervical region, down to include the pelvic. The pelvis, we're not interested in viewing the hip joint as per se, but what we are interested in is do an actual proper view of the SI joint as well as of the iliac crest, because we want to identify first of all the Risser sign for skeletal maturity, and we want to identify the parameters related to scoliosis and to the tilting as well as angulation of the pelvis. Now, just to make sure that this marker, the right marker, is in a proper place. This is the heart, so this is the left side, this is the right side, so we are or this marker has been put correctly. Now the first step is to have a general look at the spine. As you see, the image should include the thoracic cage as well. Now here it's cut short. For the first time investigation, it's more appropriate to have it in full, and the reason behind that is you want to identify if there are or is any congenital anomalies in the spine. As you know, throughout the history taking part, you will be able to identify if your patient or actually you will be able to say, okay, most probably my patient is idiopathic. As you all know, 90% of cases are idiopathic, but there are 10% of patients who are congenital, either congenital or most probably either congenital or neuromuscular, but there are far too many other causes as well. So if you, in your history taking, if you observe that your patient is a CP patient, so you will be thinking about might be related to neuromuscular disorders. If you see your patient is having like some congenital anomalies, maybe some fault in the heart or anything like that, then you'll be thinking, okay, it might be a congenital case. Now, when you view the image, the X-ray image, you'll be looking if you can find any congenital anomaly, apparent any congenital anomaly in the X-ray image. If yes, then you'll go for the CT scan. You'll be having, it's most accepted now to go for a CT scan to identify the exact congenital anomaly. Now, in this case, I'm looking for at the vertebrae. First of all, looking at the vertebrae and the ribs in general, and then looking at the ribs, they are separated, they are not fused at any level from both sides. Then you will have to count them. As you all know, these are the floating ribs, so you'll be counting them, and yes, they are 12. And on the other side, they are again 12. So some patients have duplicate ribs, others have missing ribs, so you'll have to be looking for these criteria as well. And then I'll be looking for at the vertebrae itself, starting from above or starting from below. It's up to you, totally up to you. Now here, when looking at the lumbar region, I'll be looking for the brims or trim lines of the vertebra, here, each vertebra, and then I'll be visualizing the spinous processes as well at the lumbar region, because if your patient has a spina bifida, then the actual representation of spina bifida in the images is a missing spinous process. Here I can visualize all spinous processes at the lumbar region, so I'll exclude spina bifida at the for the time being. Now let's go further and look at the thoracic region, and yeah, I do have the ribs. The ribs are in having clear edges, and even if, sorry about that, even if you have like a wedged vertebra at this region, if you have a closer look here at this specific region, okay, this we can, or let's zoom it in. At this specific region, okay, what you can find or what you can see is it looks like there is a wedged vertebra. Let me draw the borders so you can actually follow what I'm saying. And let's play with the colors. And again, these lines are drawn at the edges of the vertebral body. And yeah, I can actually see that there is something in the dimension of this vertebra. So if I measure the distance between the edges at the right side, the edges of the vertebra at the right side is not going to be the same as that on the left side. At the left side, it's smaller. And this is actually typical to be seen and to be found in a scoliotic patient or on an X-ray image. And the reason behind that is actually the vertebrae of a scoliotic patient at some age, some of the theories explain that as related to the intervertebral discs. Others do consider it as a progressive action of the vertebra, in which case the apical vertebra or the vertebra at the apex of the curve do start to take an wedged shape. So that's all about the observing first view of the image. And now let's have a closer look at the parameters that we are interested in. And as a start, always when you start investigating a scoliotic patient X-ray image, the first step to do is to draw the central line. And to draw the central line, what we have to have is a clear vision of the sacroiliac joint, to identify the edges of the sacrum, and then to centralize the central point of this sacrum, and then to draw a vertical line based on this center. So again, let's have a closer look here. And if I want to draw a line at the sacroiliac joint, so what I could say is, okay, this line represents the sacroiliac line, and depending on the parameters that I have here, it is horizontal. There is no angulation in this line. So now the next step is to actually measure the length of this line, and it is about 8 centimeters. So the center would be the 4 centimeters. Let's just double check it a little bit further. Again, and yes, that's it. This is the center of the line. Now let's zoom it out, and now let's draw our line. Again, make sure it's 90 degree, depending on the parameters here. For a vertical line, the width has to be a 0 to identify it as a perpendicular line to the horizontal. For a horizontal line, the height has to be a 0 to identify it as a horizontal line, an actual horizontal line. So now this is our central sacral vertical line. What I'm going to do is actually to try and make it clearer, the weight. Okay, so this is my central sacral vertical line. Let's zoom it out. And now here is my central sacral vertical line. I can clearly see that, from my understanding of what is a central sacral vertical line, that this is the actual correct position of the spine in perspective to a PA image. And the patient, or this patient in this image, does not have a spine that is aligned in the center. As a definition, we know that the vertebral column is the central bone structure in the trunk region. And this is not centered whatsoever. So as we said, it's not centered, so there is a side-to-side bending, which is one of the 3 components of scoliosis. So now I can identify that there is an actual curve in the spine. Now this curve is very clear here at the thoracic region. Next step is to identify the name of the curve depending on what? On the apical vertebra. Just to remember, any curve with an apical vertebra between T1 to T3, we call it as an upper thoracic curve, or sometimes they call it as a high thoracic curve. T4 down to T11, it's a thoracic curve. T12, L1, it's a thoracolumbar curve. L2 to L5, it's a lumbar curve. And there is another thing which we call as an incomplete lumbosacral curve, which we'll talk about later on. And that is specifically a curve name for the sacral region. So,